Hi everyone, this is Dr. Akash Mangukiya again and welcome to my channel. So first of all, I want to thank you all people who have liked my previous video, and if you are new here then check out my previous video which is about how to start an USMLE process. So in this video I'm going to give you information about the all visas that you will need in your whole USMLE journey plus your residency. So without any further ado, let's just get started with the video. So in this video we are going to talk about the visas obviously, and there are total 3 types of visa that you will encounter in your whole USMLE journey and residency. First type is your B1 B2 visa, second is your J1, and third is your H1B visa. So I'm gonna go step by step, and first we are gonna talk about is B1 B2 visa. So as all of you know that usually B1 B2 visa gets approved for either 5 years or 10 years. It really depends on the country from which you are applying from and your nationality too. So where you will need the B1 B2 visa, and is it necessary to have the B1 B2 visa? So yes, it is necessary to have B1 B2 visa, because if you want to do your USCE in the US, then you have to have B1 B2 visa, and if you want to give your step 3, then you have to have your B1 B2 visa. So USCE duration is depends on you, how much USCE you want to do. Mostly people do 3 or 4 USCE, and that's enough for them. And you should know that B1 B2 visa duration is only for 6 months for one time, so you have to finish your USC before 6 months. And for step 3 you have to get the B1 B2 visa, because step 1 and step 2 you can take it from your home country, but step 3 you have to take from United States only. So for that reason you will need B1 and B2 visa. There is not so much role for B1 B2 visa in residency, but if you want to get to the residency you will need B1 B2 visa in order to take this all. So now we are going to talk about the another visa, which is our J1 visa. You will need J1 visa in residency, and hospital will sponsor it. There are 2 types of hospital in United States for IMGs when it comes to sponsoring the visa, whether they sponsor J1 visa or H1B visa. So we are going to first talk about the J1 visa. So J1 visa, it's like an exchange visa. It depends on your course length. If your course is like 3 years, so they will sponsor J1 visa for only 3 years. If your course is for 5 years, then they will sponsor for 5 years. After that you have to get back to your country. So after you complete your residency you have to get back to your home country, because no one is sponsoring your J1 visa. But there is a way if you don't want to go to your home country. Lots of people consider this, and that is J1 visa waiver. In this you have to work in underserved area after you complete your residency, and that is also a nice option if you don't want to return to your home country. And after finishing that, people usually apply for fellowship. In fellowship it is also similar to residency. They will sponsor your J1 or H1B visa. It depends on them and in which program you have applied to. And one more thing I have to mention is PR. If you want to apply for PR, or if you want to apply for a green card, it is not possible on J1. You have to have H1B visa in order to apply for green card. So after you complete your fellowship, and if you get a job in United States, and if they are sponsoring your H1B visa, then only you can apply for green card. And this is the downside for J1 visa. So now we are going to move forward and talk about H1B visa. So in H1B visa, like I said, it depends on a hospital whether they sponsor your H1B or J1. So if hospitals have sponsored your H1B visa, you can directly go on and apply for your green card or PR. And in this you don't have to go back to your home country after you complete with your residency. You can directly go on to apply your fellowship on H1B visa. But there is a catch. There are so few hospitals which are sponsoring H1B visa in fellowship. So you have to be careful in applying the program, because there are so less hospitals which sponsor H1B visa. So what if you don't get H1B visa after you complete your residency and you get J1 visa? So if you have applied for your green card in your H1B visa after you get into residency, those years will not count because your visa status is changing. So this is also a downside for H1B visa. Both visa have downsides and both visa have their plus sides. So you have to take visa type in your consideration while choosing your program and while you make your rank order list. So it is totally fine whether you have your J1 visa or H1B visa. They are not gonna judge you on those visa types. Whichever visa type you are getting, just take it. Don't deny any program because of just the visa. It's about the residency. You will have to work so hard to get that spot into residency, so don't deny it. Whichever visa you are getting, just take it. So there is lots of information available for visa for residents in internet. I have just given briefly explanation on visas that you will be encountering in your USMLE and the residency. So if this video was helpful to you, then please hit the like button and subscribe to this channel. I will really appreciate it. And thank you very much for watching this video till now.